dietitian and OncoPower's Director of Nutrition. Cancer treatment can have a lot of side effects, and one of the more unexpected ones is skin changes. Skin changes most commonly occur when you are having external beam radiation or with some targeted therapies. If you're having external beam radiation, expect these skin changes to happen about week 3 of therapy and to persist sometimes after therapy ends. These skin changes mostly look kind of like a sunburn, red and irritated skin, but could end up with darker pigmentation, dry skin, itchy skin, and that sometimes blisters. If you are having targeted therapy, skin changes often occur also after the 3rd week, and they may look more rash-like, a lot more dry, itchy skin. You may also have some hair loss and some nail changes. Nutritionally, in order to battle these skin changes, first of all, you want to make sure that you are hydrated. Most adults need about 8 to 10 glasses of water a day in order to make sure that they have enough water in their body. You also want to make sure that you are drinking mostly water, like I said, but also teas count towards this. You could also choose a little bit of fruit juice that's watered down. Seltzer water is a great choice if you're trying to stop drinking soda, but we do want to limit our sugar intake. You want to make sure that you are having lots of brightly colored, darkly pigmented fruits and vegetables, as they contain a lot of antioxidants that are key to skin cells, mostly A, E, and C. And we also want to make sure that we are meeting our protein goals, because protein is essential for any damaged tissue to repair itself. Make sure you are including good sources of healthy fats like olive oil, avocado, and nuts, as good healthy fats are essential to skin barrier maintenance and repair. If you're noticing these skin changes, please tell your doctor anytime that you have them. They may need to prescribe special creams or ointments in order to heal or prevent infection of any damaged tissue.